signing a letter and they want to meet with you about, they say that there's a crisis there and about staffing issues. Will you meet with them, given the modelling that was released yesterday?
Well, obviously, the modelling released yesterday also confirms the various plans put in by staff. I've been in contact with a number of staff and a number of health experts who've given government direct advice, and obviously the Minister for Health is always in daily contact with staff as well. And no doubt when you have 140,000 staff throughout the health system, people are going to be worried, but the vast majority of people I speak to accept the stressful time ahead, but also are up for the challenge. They've worked all their careers to support the community during the most difficult time, and none of us said it's going to be easy, and we put our hats off to all those people who are willing to put their own safety on the line to protect others, people like Auntie Pauline, who works with COVID patients and others, and certainly no one is suggesting it's going to be easy, but what we wanted to do as a government, what we wanted to do in terms of the health advice is provide exactly what we had so that everybody is aware of the information that's been presented to me in the government, so that we all know the plans that have been put in place, and that's why we're also keen for specialists to brief everybody and speak directly on the plans that they've put themselves in the language that they've used to make everybody aware of what we're likely to expect.
No, localised, just want to clarify that. Do you mean that we might see LGAs go into lockdown post 80%?
Well, until you get to 80% double dose, the Doherty report says that from time to time there may be some restrictions that come in place temporarily. So it's not till 80% double dose that prevents you from ever having a statewide lockdown. And so it's critical we don't anticipate, because of the rates of doses in New South Wales or the vaccination rates, we don't anticipate there'll be a big difference in the time between 70% double dose and 80% double dose. Once we hit, Dr. Chan and I are closely monitoring the day that the state hits 80% first dose, because then we'll have the confidence that we're going to get to that 80% target, which a lot of places around the world haven't even achieved yet. But at 80% double dose, the Doherty report says that there's no reason why you should have a statewide lockdown so long as you maintain an eye on those outbreaks from time to time. But as we know, there could be issues where a workplace has cases and may be temporarily closed. There could be a school. We've seen that already during last year when we kept the state open. There were instances when, if there was an outbreak, there'd be a temporary closure or dealing with an issue, and that will be part of living with COVID. If there's a high concentration of cases in a small area, whether it's an institution or an establishment or a venue, well, obviously for a small period of time that venue or that activity won't continue, but that will be very localised and temporary, certainly nothing like what we've experienced this year or even last year.